All right, we can move on to our selected talk. So this talk is from Sharon Barazani. Sharon's been working with us in the cardiovascular imaging group for quite some time now, very hard on this project. She is a first-year medical student, actually, and her bachelor is from Stanford in biology, so we are very excited to have her here. So she's going to talk to us about the detection of uric acid crystals in the vasculature, actually, of patients with gout. Very interesting topic since we're interested in inflammatory diseases and cardiovascular disease and imaging. So very excited to hear from her.
Thank you. Hi, everyone. So today I'm going to be talking about gout and specifically using dual energy CT to look at the vasculature of patients with gout. So first I want to start off with a background of what gout is. It's a kind of arthritis. It's extremely painful, and it's caused by buildup of uric acid. So generally there's two ways you can get the buildup. Either you have too much uric acid in your bloodstream, or patients' kidneys are not functioning properly, and so they're not able to excrete enough uric acid. This disease has been around for literally thousands of years. It used to be called the disease of kings. And I mention that because it ties in really well to the risk factors. So diets high in meat, especially red meat, as well as seafood and fructose, alcohol consumption, particularly beer, gender, males are much more likely, sorry guys, and then certain medications such as aspirin, race, age, and weight. It's still extremely prevalent today, so between 1% to 4% of the population in developed countries is afflicted with gout, and research has shown that this number is growing and not getting smaller. And I mentioned before that we looked at patients with tophaceous gout, which is a chronic form of gout, and it's characterized by these also extremely painful nodules that form in the joints. And so here you can see it in a patient's finger, and these uric acid buildups occur in 12 to 35% of gout patients. And so I'm talking in the cardiovascular section, and so there's a big link between gout and cardiovascular disease. So there's hundreds of papers out there that show that gout or uric acid is an independent risk factor for cardiovascular disease. People have looked at all different types of cohorts and different ages and different genders and different demographics and found this to be true. But no one knows why. There hasn't been, none of these papers have been able to say why this is true. And so this was our hypothesis. So gout starts in the joints. It's generally how it first presents. And you can see here, this is an example of a dual energy CT scan. And the green represents the uric acid, and it's accumulated in the fingers and the wrist. And then we thought that the gout is also going to be building up in the vasculature of patients as well. And as this gout builds in the vasculature, it causes inflammation, and this inflammation is what's leading to cardiovascular disease in patients by way of atherosclerosis. So briefly, we use dual energy CT, which operates through two X-ray sources that the beams operate at the same time, and then based off of the attenuation of the material, the software is able to differentiate between bone and soft tissue calcifications, and in our case, uric acid as well. So first we wanted to test the scanner sensitivity to make sure that it is indeed actually finding uric acid. So we bought powder crystallized uric acid and put it in organic solution as well as water and scanned that. And so you can see the last 5 vials, it does actually show up, which is good. And then we also scanned bladder stones from the urology department. The leftmost and the rightmost stones are supposed to be the highest concentration of uric acid. And so that green, again, is the uric acid. Purple is supposed to signify calcifications. And so we do see in the leftmost and the rightmost tube that we are, again, seeing that green showing up. So this is a video of our software. So the legend, again, green is gout, purple is calcium. And you can see in the patient's left hand and left wrist that there's the green accumulating in the joints. And it's hard to see in this video, but the scapula as well as like in the costochondral joints, you also see gout forming. And so we saw in papers that gout patients do suffer from back problems. And so this could perhaps be a reason why as well. So this is an example of our CT scans, a 2D scan. And this is a patient's aortic arch where we see this nice chunk of uric acid really prominently. This is another patient. Here it's in the left coronary artery. Here it's in the descending thoracic aorta. And here again in the ascending aorta as well as in the coronary artery. So all throughout the vasculature, we're seeing these spots come up as well as in the iliacs too, and then the carotids. The way that we quantified it was we would circle each discrete spot. So in this image, there's about like 6 or 7 discrete spots. We would receive an area, and then using the slide thickness, we could calculate a volume, and then we would add that up for all the patients. And then we segregated it based off of section of the aorta. So you can see up here, it's different sections of the aorta. This is all of our tophaceous patients. The colors are sort of signifying how much urate they had. Only 2 out of the 15 patients didn't have any urate at all. So it is pretty significant. Almost all of our patients were showing up with deposits. Then we wanted to look non-tophaceous patients. We thought that we started with the tophaceous patients because we thought that because they have a more chronic form of the disease, that they might have more uric acid in their joints as well as in their vasculature. But we also wanted to then compare that to non-tophaceous patients and see if maybe they had less. And they did have a little bit less. So, sorry, the average volume here was 145. And then the average for the non-tophaceous patients was 116, so it was a little bit less. They still all are showing up with a high amount of uric acid as well. Only 1 patient of our non-tophaceous didn't show up with anything, which actually kind of makes sense because in all these papers that I mentioned before, they did look at gout patients, and it was gout patients that they were confirming have this risk of cardiovascular disease. This is another representation of our data. So the middle bars are representing the average, and then the top and bottom are the standard deviations. So you can see there's a spread, and there's slightly more tophaceous patients that are slightly more uric acid in our tophaceous patients. So as for our future plans, we're still recruiting patients. So if you know anyone or if you have gout or are interested, you can come up and talk to us later. We also want to do a PET MRI study. We want to confirm that the uric acid we're finding in patients' vasculature is causing this inflammation, and so we would be able to see that on a PET MRI study. We also are applying now to recruit a healthy control group, and we want to look at patients that have a similar, similar age and similar background, and if they have similar levels of uric acid as well. And hopefully patients that aren't symptomatic and aren't gouty do not have any uric acid. And lastly, we're also in the process of writing a grant. So I want to give a special thanks to Dr. Chi and Dr. Ali of the rheumatology department here, as well as Renata Vinky and Zahi here at tMII, Tom O'Donnell from Siemens Healthcare, and Dr. Adam Jacoby in radiology. We can open up to questions.
So if you have any questions, just please come up to the microphones. And if you don't, I do. So actually, I guess my question was, I believe your delineation of the crystals was actually semi-automated, right?
Mm-hmm.
Is that correct?
Yeah.
So just to link with the previous talk, how do you think that could have helped you, right? I mean, they were doing a lot of automatic classifications and stuff like that. So that's, that was my question.
Yeah, I definitely think the more automated that the software gets, the better. Right now, we're actually calculating volume ourselves, but I do think it could be automated that it could just recognize whatever is green and quantify that by itself, I'm sure. So that would be helpful.
All right. Very well. So thank you. Oh, this is your certificate.
Thank you.